Did you know that heart failure impacts millions, leading to nearly 400,000 deaths annually in the US alone? Recognizing its early warning signs could mean the difference between life and death. Before it's too late, discover the critical symptoms you must never ignore to protect yourself and your loved ones. Number 10. Persistent coughing. One of the earliest and most telling signs of heart failure is a persistent cough. This type of coughing arises due to fluid accumulation in the lungs, a direct result of increased pressure in the heart as it struggles to pump blood effectively. The fluid buildup can trigger sudden and intense coughing episodes, often accompanied by the production of white mucus. However, if the mucus appears pink or blood-streaked, it may indicate the presence of blood and a more serious underlying condition that requires immediate medical attention. This symptom can worsen significantly when lying flat, suggesting pulmonary edema, a condition marked by excessive fluid in the lungs that makes breathing difficult. According to the American Heart Association, pulmonary edema can be life-threatening if not promptly treated, as it leads to reduced oxygen levels and increased strain on the heart. Recognizing and acting on persistent coughing early can be crucial in diagnosing and managing heart failure effectively. Number 9. Throat and jaw pain. Throat and jaw pain, while seemingly unrelated to heart health, can be a subtle sign of heart failure due to referred pain. This type of pain occurs when discomfort is perceived in a location different from its origin. Unlike dental or muscular pain, heart-related jaw pain is typically described as a burning or heavy sensation and can often be triggered by physical activity or emotional stress. Studies indicate that jaw pain related to cardiac issues affects up to 15% of patients, though it is often overlooked or misdiagnosed. The American Heart Association highlights that understanding atypical pain locations is essential, as heart disease can present differently in different individuals, especially among women. Pain that appears suddenly and does not change with movement or external factors should prompt an immediate medical evaluation to rule out cardiac issues. Number 8. Excessive sweating. Excessive sweating, particularly without physical exertion or an obvious cause, can be an early warning sign of heart failure. This symptom is often due to the body's attempt to compensate for the heart's reduced efficiency in pumping blood. When heart function declines, the body's nervous system activates sweat glands in an effort to regulate body temperature and maintain fluid balance. The process, known as osmosis, moves fluid from areas of high concentration to low, aiding in maintaining homeostasis. The European Heart Journal published findings showing that excessive sweating often coincides with other symptoms like shortness of breath or fatigue, signaling that the heart is under significant strain. Individuals who experience profuse sweating accompanied by other signs of heart distress should seek medical attention, as this may indicate worsening heart function. Number 7. Frequent urination, especially at night. Frequent nighttime urination, also known as nocturia, is another common yet overlooked symptom of heart failure. It occurs when a weakened heart results in fluid buildup during the day, leading to reduced urine output while upright. As a person lies down to sleep, the fluid shifts toward the kidneys, increasing urine production. This symptom can be particularly disruptive, leading to interrupted sleep and chronic fatigue. According to a report by the National Kidney Foundation, up to 50% of individuals with heart failure report experiencing nocturia. The relationship between heart function and kidney performance is vital. When the heart fails to deliver enough blood to the kidneys, they cannot filter and manage fluid effectively. Monitoring nighttime urination frequency can be an essential factor in detecting heart-related issues early. Number 6. Loss of appetite. A significant, often overlooked symptom of heart failure is a loss of appetite. This occurs because reduced blood flow affects the digestive system, slowing down its function and leading to sensations of fullness even after consuming small amounts of food. This diminished blood flow can also contribute to nausea and bloating, further reducing the desire to eat. Clinical findings published in the European Journal of Heart Failure suggest that malnutrition is prevalent in nearly 45% of patients with chronic heart failure. This can lead to muscle wasting and unintended weight loss, which exacerbates the condition. Unchecked, This cycle can weaken the body further, putting additional stress on the heart and hindering its performance. It's crucial for individuals who experience persistent loss of appetite to consult their physician, as this may signal worsening heart function. Number 5. Unexplained weight gain. Sudden, unexplained weight gain is commonly linked to fluid retention, a hallmark of heart failure. This fluid buildup can occur in the abdomen, legs, and even around the lungs, causing discomfort and visible swelling. A report from the American College of Cardiology notes that sudden weight gain, typically defined as a gain of more than 2 to 3 pounds in a single day or over 5 pounds in a week, should be closely monitored, as it may signal worsening heart function. The retained fluid can place further strain on the heart and compromise circulation, leading to more severe complications. Weight tracking and regular check-ins with a healthcare provider are vital strategies in managing heart failure effectively. Number 4. Dizziness and fatigue. Dizziness and fatigue are common symptoms of heart failure and can significantly disrupt daily life. Dizziness may occur due to orthostatic hypotension, a sudden drop in blood pressure when standing, indicating that the heart struggles to pump blood efficiently. This insufficient blood flow can also lead to persistent fatigue, leaving individuals feeling drained even after minor activities. According to the American Heart Association, approximately 60% of heart failure patients report chronic fatigue that impacts their ability to engage in normal routines. This occurs because the body redirects blood flow to vital organs like the brain and heart, reducing circulation to the limbs and muscles. Proper management involves not only medication but also lifestyle adjustments, including balanced rest and activity periods to improve energy levels. Number 3. Heart palpitations. Heart palpitations can present as a rapid, irregular heartbeat and may be a sign of heart failure. These sensations can range from minor flutters to more pronounced pounding that disrupts regular activities. Palpitations often occur when the heart's upper chambers contract prematurely, throwing off its rhythm. The Journal of Clinical Cardiology found that arrhythmias or irregular heartbeats are common in more than half of heart failure patients. Palpitations can be exacerbated by factors such as low potassium levels, dehydration, and high caffeine intake. While occasional palpitations may not be a cause for alarm, frequent episodes paired with chest pain, dizziness, or shortness of breath should be evaluated by a doctor promptly. Number 2. Swelling in the lower body. Swelling in the feet, ankles, and abdomen, known as edema, is a symptom that should never be ignored. It results from fluid leaking into surrounding tissues due to the heart's reduced pumping ability, causing blood to back up in the veins. This swelling can become painful, restrict movement, and make wearing shoes difficult. In severe cases, the abdomen may also enlarge, causing discomfort and added pressure on the stomach and diaphragm, making breathing more difficult. According to the Heart Failure Society of America, over 30% of individuals with heart failure report significant swelling, and addressing this symptom with diuretics and other treatments can help reduce fluid retention and improve comfort. Number 1. Shortness of breath. Shortness of breath, or dyspnea, is one of the most common and distressing symptoms of heart failure. This symptom often worsens over time and may be most noticeable during physical activity or when lying down, as fluid accumulation in the lungs becomes more pronounced. The National Heart, Lung, and Blood Institute reports that nearly 70% of heart failure patients experience this condition. Difficulty breathing, especially at night, a condition known as paroxysmal nocturnal dyspnea, can disrupt sleep and exacerbate fatigue. Elevating the upper body while sleeping can provide temporary relief. Persistent shortness of breath, however, requires immediate medical attention to prevent progression to severe complications such as pulmonary edema or cardiac arrest. Thanks for watching. We hope you found this information valuable and eye-opening. If you learned something new today or found this video helpful, please give it a thumbs up and don't forget to hit that subscribe button. Stay informed, stay healthy, and we'll see you in the next video.